why some seemingly healthy individuals will just suddenly collapse, fall down, and pass away tragically. And we have someone, he is not a new face or a new day. He's someone that we always enjoy his insights into some of the health concerns. He is Dr. Ugwunna Chinedu Nwachukwu. He is a consultant community health physician with UNTH Ituku Ozala. Doctor, you're welcome to the show.
Thank you, moderators and listener, viewers. We're here once again to talk about a health issue that would sincerely trip your fancy.
Absolutely. I mean, seeing you on your clinical attire,
you came prepared.
You came with your scrub, if I'm not correct, and your lab coat. I'm excited myself.
Don't worry, we're just jumping from office to the studio, and then want to deliver the thing and go back to our clinical work. We're from the field, and we still want to do that. It will just do us a good thing that will be on watch out. Slump and die, as you just said, may not be an issue that will play with the kiddies good of, because it has been there all. Remember Okwaraji, remember Kanu Wankwo, you remember was Christian Ellison, Kanu Wankwo and Christian Ellison. They didn't die, but they slumped.
Seems like you're a sports. But before we go down that route,
no, but you know, it's profound more on those activities.
Yes.
You see them more there. That's where we're...
Okay, now you are talking about it. You know, the guy I mentioned when I was introducing the show, the segment, Jaya Bodering, he actually died coming from a sports event. I think it was table tennis or lawn tennis, and afterwards he just slumped and died. Onyekowenu died after an active performance, you know, at a birthday party, and she slumped and died. So, are you trying to tell us that increase in physical activity can predispose someone to slumping and dying? But before you say that, before you get to that, hold on. Before you get to that, what exactly is slump and die syndrome? It seems as if this is something we coined from local parlance, kind of. You know, so what exactly is slump and die? You know, so let's understand what we're going into.
It's just like, if you want to do it in that local parlance, you are free and clear, because what it means is just that slump and die. But ordinarily in clinical terms and in medical world, we are not viewing a slump and die with that's a light microscope, because it is not a diagnosis to say. It is an umbrella, general umbrella we use to describe, it's a term we use to describe sudden, uneventful deaths that occurs within 1 hour of maybe witnessing the symptom, and then within 24 hours for unwitnessed events. A lot of slump and die, those slump, you know, you are being in activity and slump and die. But this syndrome had happened more often when people are sleeping. You say they passed away. This is equally part of slump and die. So generally it is disease or deaths that occur from natural causes within 1 hour of witnessed symptom. The person will not say that I'm just having a 1 hour the person died, or within 24 hours of somebody who apparently have no symptoms at all and have no disease whatsoever, and all of a sudden the person is gone. And oftentimes the diagnosis is not placed on. You don't know what causes it until after autopsy must have been done to give you an insight of what probably would have caused this incident. So it's a dear moment, and it's something that...
Yeah, let's talk about the second part of my question.
I'm very concerned because the fact that you said 1 hour, the symptom shows from 1 hour, and then there is an... Yeah, so why 1 hour for people who have the symptoms, and what are those symptoms that you look for? Because she already asked, is it because I'm active? You know, all these people were active.
Is there a direct relationship between your physical activity and slump and die?
Yes. Yes.
So I should not exercise again.
Don't get me wrong.
Okay.
What I'm trying to say, most times, if you look at the slump and die, the symptoms we are talking,
Yes.
about half of it, 50% of slump and die may not come with symptoms. You will not see it. But then sometimes some of the symptoms may come and people may mistake it for some other thing. You may just wave it off. Just like in normal days, if you have a bitter taste, you blame it on malaria. If you have a headache, you blame it on malaria.
And typhoid.
Okay, but those people are waiting. One day will be waiting for us on road to heaven. For some of us who go to heaven. For those who if you wait and say, giving you a knock, you give me a false accusation. Because a lot of us has falsely accused malaria and typhoid. So what I'm trying to say is just like something like a brain aneurysm, which is one of the foremost cause of slump and die, may come with a headache, a severe headache. You think that you'll busy be taking malaria drugs and taking all paracetamol and feel that you're having that. Then again, there's this stiff neck. It may come with it, but you may not get it on. You feel like you are going. But most often, the other symptoms that you can get at may be chest pain. Somebody may be having chest pain, and then all of a sudden, within that 1 hour of having that chest pain, the person is gone. Or the person may having, let's say, shortness of breath. Before you know it, the person is gone. Though some others, that's what I'm saying, that ordinarily you see the person looking well. Within 24 hours, the person, you last see the person, you say, oh, for all I know, this person is well. But within 24 hours, you've seen that person died. And it's from natural cause. It's not unnatural cause like bullets hitting the person or some other thing, but just like natural. We said the person slept in his,
passed away.
Exactly.
Okay, but doctor, let's try and follow this systematically, because I can sense you have a lot to pour out. However, we don't have that kind of capacity to assimilate everything at once. So we're going to take it systematically.
Right.
I want you to just mention to us some of the ailments that can constitute or come under, because you said it's an umbrella word. What are some of the ailments that can come under that slump and die syndrome, right? So when we're done with that, then we now talk about the signs that you can see, because
you really, allow him answer this.
No, hold on. I'm afraid. If you're not afraid, I'm afraid. I need to talk about this, because from what you just mentioned, it's as though someone might think, oh, there's no hope. Probably don't go to the gym, because if you overexert yourself, you could fall and die, and then you could sleep and not wake up. So let's categorize those ailments that actually come under that umbrella of slump and die.
The key things, if I must put them in system, the key systems that are very important or play roles in this slump and die has been the heart and the lungs. They are very important. Anything that makes the heart not to beat or beat abnormally, it's going to, stop the heart appropriately will lead to slump and die. Anything that will make you not to be breathe well, because the heart itself try to get somebody up to this blood system. There's electrical stimuli that gets on, and then it gets the heart to be beating. Anything that alters this stream of electrical action can lead to death. Then in that of lungs, it supplies the air, the oxygen that the body, anything that stops that oxygen to get on to the brain, that person will faint or die. Now, let me now get to the diseases, if you want to. The other ones that can, but let me just pick it up. I say that about 50% of the slump and die cases as a result of cardiac, that's heart origin. So part of the things that there's coronary artery diseases. Coronary artery is the artery that supplies blood to the heart. If there's a problem with that supply to their heart, it will cause problem. And this will lead to the heart suddenly stopping and then dying. And then once it stopped or died, what we call in our parlance as sudden cardiac arrest. Then you say cardiac arrest, people have a heart attack. So this can. So if there is a coronary artery disease also, there are also what we call sudden arrhythmic disease. that's making the heart not to, it's rhythm as it's
When you
beating.
hear
That one is palpitation. So,
my heart is doing me.
sometimes the rhythm, the hearts have lob dub, lob dub, lob dub, lob dub. So, but if there's something that makes it not to call, maybe lob dub, lob, either delaying it or making it lob, 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 then that can lead to that. So there is an arrhythmic condition where the heart is either beating very, very fast or slow, because that beating is letting go the heart, the blood to the systems where they are needed. So if it's not doing that function, there will be a sudden arrest, and those system that needs those blood will not function, and they get suffocated and then die. The person will not have that sudden death. Now, what diseases are we looking at? If you have those coronary artery diseases.
Doctor, please, before you go for the diseases, there's a comment here asking, what are those things that make my heart beat faster? And I'm sure this person asking you to, because when you exercise, your heart beats fast. Yes, it goes. So the person is asking, what are those things that can make my heart beat faster?
That's what I'm saying. Things like this exercise, when you do exercise.
Yes.
Now, if your heart is normal, it doesn't have, it will accommodate and adjust. But if there's problem that reduce that, it will not, adapt to the pressure, the need that the body needed for the heart to be missed. It will just like, as you are running, that's the time you are running. If you are not keeping with the pace of that run, you either fall or get out. That's exactly what is happening with the heart. So if there are other things you can, there's some medication that you take that will get the heart to. There are some other diseases that will narrow the supply. That coronary artery I'm talking about supplies blood to the heart. If something narrows the supply to that blood, to that heart, the heart will be, and then the heart can beat fast. If you miss obstruction somewhere, it will now try to, beat to overcome the obstruction down the line. So that's why it was always good. The people who say when you have hypertension, there are some blocks, the cholesterols, the lipids that tend to block the lumen of the blood vessels. This will block it. So if the heart is just beating to push it out, it can. Then when you have some unsavory information that somebody died, then your heart can boom. It can cause a lot of anxieties, and things that causes anxieties can cause. If your heart is at its best, your body can accommodate that. But if it is not already compromised, you now see it can't meet up with that condition, and that person suddenly died.
Let's take it up from there. You're trying to explain, okay, the heart needs to accommodate and adjust.
Yes.
Right? Now, it is advised that we exercise. In fact, when an individual goes into a fight-flight mode, your heart rate goes up. I think it's a natural thing. I'm not a doctor, I'm just saying, but you've agreed to that. It's a natural thing.
Yes.
Now, at what point do you get to know, my heart is not adjusting, help me, my heart is carrying me to where I don't know. At what point?
You only know if you have a constant check. Okay? Now, what I'm saying, that some people have congenital diseases.
What does that mean?
Congenital is inborn. The things that are from birth, that genetically is determined as they are formed in the womb. Genetically, it is determined that they have that. They inherit it from their parents. Right? So if you have that, you may not know. Just like these people who are talking, most of them don't know that they have heart conditions. So you only know when you have this habit of checking up, knowing your health status, and then knowing where to go from. You can detect something that is abnormal and then try to sort it out. So that's the only way you can. Internal vigilance is the point. If you are driving a car, how do you know?
I was going to get to that car. I was going to say, Doc, but we drive cars. The only thing I know in a car, I don't know much, is when your timing belt, breaks in the middle of the road. It doesn't give you sign. But for other ones, you have sign. So I'm saying, is this slump and die syndrome, isn't it a misnomer? Didn't your body give you one or two, which was why I asked
because
you?
Because one number is short.
You understand? Which was why I asked you,
No.
When, at what point will your heart not adjust and you start crying, help me,
You drive a car. Sometimes you hear knocking sound. You don't know. I say, okay, when I come back tomorrow, I will check. I come back tomorrow.
So you will agree with me that it's not so sudden.
The sudden is that it happens. But the truth is just like, if you look at it, it must have given you warning sign. Something like that hypertension. Some hypertensive things. Some people have, if their blood pressure rises, some have come down with headache. Some come down with dizziness. Some come down with, yes. Some come down with palpitation. So some that comes with headache, they will ignore it. They will now give it to malaria and then take malaria drug. What your body system does at that point is just like, once you give you that warning sign, and you didn't do something about it, you say, hey, maybe I'm over-worrying myself. Maybe it's normal. At that point, that high blood pressure that your body is at, he sees it as normal. But it's abnormal. He will only give you that sign again until it goes beyond that. And if you didn't do something again, and you went and they go and take your paracetamol, it leaves you. It will continue rising until up to a point that will now burst the artery that supplies the brain. Then you now have stroke. We are talking about the hemorrhage. That's part of sudden death. It can lead to sudden death. Stroke is another cause of sudden death. And at the end of the day, if you will not say that he didn't tell you, he has been telling you, but you are not able to sense the thing, and then you can't do it alone. It's always fine. That's why the old paracetamol jargon normally say, if symptom persists after 2 days,
go see doctor.
Now I'm understanding that statement where they said health is wealth. Because honestly, this is in low key, I'm afraid. Like,
don't be. Come back.
Okay. Thank God. Let me not panic. I'm not going to panic. So, I want to ask now, what should someone do immediately if they see someone collapsing? Like, if I see somebody collapsing, what should I do immediately?
Yes, it's what we call cardiopulmonary resuscitation. That's what we call CPR.
Okay.
Fine. Well, then that's the best you can do for the person. And then await the ambulance arrival. You now ask me how many...
Are we talking Nigeria?
In Nigeria.
We're still talking.
Okay.
Yes.
For a minute, I thought I was the Hollywood.
Honestly, waiting for ambulance. Okay.
Don't worry. As we are copying everything from them, we can copy that, right? But that's the right thing to do.
But how do I do a CPR? Even before you...
How many people know CPR?
Yes.
No.
Okay, take us through a crash course on CPR.
The point I'm trying to get about that CPR is just like, it's always... You see, my biggest problem with things is just like, is it half big person is worse than the person doesn't know at all. So personally, I don't normally come all out to do that crash thing. But I always advise that we should get our critical care system up and then have this constant education. Because if you look at majorly where you see people is within those sports facility, athletes. So we should be doing a coach-up, a remedial courses on those things for them yearly, so that they can help some people. In theaters where a lot of people come, in markets where a lot of people come, and then, please, we should now copy the West.
But Dr. Nwachukwu, sorry I just have to come in here. What you're saying is correct. On paper, it's correct. But what you're trying to say is, what are some low-hanging fruits? Because to educate people, make them aware, to get them to change their behavior is a long-term issue. We're saying, what are the low-hanging fruits? What can we do? We see someone collapsing now. What are some of the things we can do?
I've said it. The low-hanging fruits you can, the little one. I can give myself as an example. I tell you, I had an accident. And then the way I was put in, if they have thrown me out of that car like that, my spinal cord would have spared. Yeah. So the point is just like, you because they were there asking me, come out, let's just die. I said, please, because I already had something. No, I know. But, something in me says sorry. Then I tried finding an escape route and I left. So what I'm trying to say, some people may want to help. As I said, they will not carry that. Because every situation had a peculiar thing that go with it. The way you carry the patient will still may cause the death. First and foremost, the end thing is just like to open up the airways anything that
We've
trying
gotten
to.
somewhere, yeah.
Just open it. If he's wearing tie, loosen the tie.
Good.
Then if just open, get some things that will not call. Make sure that there is.
What about the issue where people will have to round up, you know?
That's what I'm saying. You try to let them get on, let the person have, and then as far as possible, place the person in a very good anatomical position. You ask me about anatomical.
You know me now.
Yeah, I bet you know me. So that's why I didn't want to get out, because it was it's a whole lot on his own. But that little you can open up the person. But my own problem is if you are sudden death, at the time you are doing these things, you just like Erickson and the kind of one could have had them. They were pre-diagnosed, and then they were able to help. But if you have that, that's one they said one woman was driving, all of a sudden she lowered. Then somebody that knows her saw the car moving, starts raising alarm. People came and held the car. They were able to break the glass, got her out, and then called the ambulance. The ambulance came. The woman is still alive. But ordinarily, if nobody is there, the woman will have gone through that. So the thing I'm just like saying that our critical care had to be up. Those ambulance services, where the passerby and onlookers can do those little things they can do, then they should pass it on to. Because first few minutes of that person's attack may determine what the person will come along.
Yeah.
They may just mess up the case by the time he's arriving at the place where they will have. So that's what I'm trying to get at. If you are there, the best you can do, not videoing the thing and sending it to what the nearest WhatsApp. But if there should be a form of education about the nearest health center around every vicinity that we can always contact.
Can I take you up on health centers, primary health care? How robust is it in Nigeria? In Enugu. How robust? Because you said, okay, you've mentioned the low-hanging fruit, and then you said to access medical care if such things happen at health centers. My question to you is, how robust do we even have doctors at these health centers?
No, ideally, doctors are not primarily, ordinarily constant features in primary health centers, right? So, but in high pinnacle of the primary health center clinic, a doctor may be present there. Now, and then that's where we call those other things that when the district health system in Enugu State has to come about, you have cottage hospitals. In those cottage hospitals, you're supposed to have doctors, about 5 of them there. But in primary health center, the highest of it is comprehensive health center. You don't see them often. In fact, in Enugu, there's one in Oboba. UNT is just, there you see doctors. But in other primary health centers, you rarely will see. But where you see them, fine. But what I'm trying to say, not just primary health centers. Those primary health centers, not just doctors. The other health care professionals.
You're saying nurses are equipped to handle such health emergencies?
Sure, of course.
Without getting any backlash from any quarters?
A backlash? No. They are better than those onlookers. They're better than those onlookers that are trained in some. Then they are better to handle the things. They can try to make sure that those things are open, the airways are open, that some fluid, that if the person has lost some fluid, they can try to replace the fluid and keep person breathing till the person gets on. Then in those health centers, you may have community health extension workers who are there, who are trained. Some try to get at. But all of them know that's a referral system. And they know the next set of people to call online. That's why you get to them. They now can trace back to where it can be gotten.
Okay, so doctor, we've seen the cases happen here in Nigeria, and it's becoming a trend, and we've seen it. I know you've discussed the causes, but broadly, I want us to discuss it in Nigeria. On a lighter note, could the high cost of fuel be part of the reason why people slump and die? But let's use Nigeria as a factor. We've seen it happen. So what are those factors in Nigeria that can be the reason why people slump and die?
The truth is just like some studies have said that the movement from rural to urban areas had a hand in it. has a hand in it. Then the other one they talked about, this is our westernization that's increased in consuming processed food. That's increased our rate of taking in salts and then some cholesterols that can worsen the state. So they equally try to look at some of the way some diseases happen, some infections that can predispose us to that. That's what if you check out when what's the name COVID came, a lot of people went. Why? Because they have underlying disease, and then this infection just worsened the thing and then take them out.
Okay, Dr. Nwachukwu, pardon me. I guess what my colleague is trying to say is that you've mentioned a lot of underlying illnesses and internal issues that can bring about this health emergency. We are trying to say, what are some of the external?
The external?
Yeah.
Okay.
What are some of the external issues? Which was why he mentioned the fuel issue.
The fuel issue is one of the social problem.
Yeah, maybe that's the question. The social problem that can cause this.
It is. Now you can look at the heavy alcohol consumption. Yes. Smoking.
Igbo or just?
Smoke. But then when you now go to the barbars, those ones can tip you off to that. Then substance abuses, they can tip you off. Then other things, you can really, this hypertension, some drugs, allergy to some drugs can tip you off to that. Then asthma because it has to do with the breathing. Yeah. So, and then if you are a patient that's down with asthma, you should at least just part of the preventive things you are like trying to get at. You should do an extra inhaler in your pocket so that if somebody comes on and then see you getting on, he can lay on that and then do the puff for you. This can be part of what can save the soul. Are you getting me? So an extra inhaler in the pocket can do the magic. So if you are having this, you said I shouldn't go to underline, but
no, you can't.
Oh, as well, you can go now. You can go.
The hypertension, the rate of hypertension those days is getting on. If you're not key with your hypertensive, treatments and monitoring, you are destined to come with this because it may give you stroke that will just like end your life.
Dr. Nwachukwu, not just you, other doctors, professors that come in to talk to us concerning whatever that has to do with health, there's this one recurring decimal, then that's constant check. Be it your bladder, be it your kidney, be it your lungs, be it whatever, they advocate constant check. Now it's as if they have been talking and no one is listening, because people really don't check until it goes bad, then they present when it's really bad. What do you think we can do? Not just, all stakeholders.
No, you always see whenever you don't fight before.
It depends on the kind of fight.
That's what I'm saying. For those primary school, if you fight the fight where you just want to, people come separate. You won't do, people come, you go to one fight. But the day when you come fight,
and there's nobody to cheer you on.
Tomorrow, if you see fights, you go say, make they don't come. So the point I'm trying to make is just like this, because we won't try fights, that's why we are just clothing with check. Check is, they said, Zebuda would normally say that provision stop is better than kiosk. Prevention is always better and cheaper than cure. So you should try to do that.
How can we instill this in policy? Because I notice people don't do things except they are compelled to do that. How can we put it in policy such that it will work and people are compelled to go for these regular checks?
Part of it is just like, but mine is just like in Igbo parlance, they said, Uzi something that you've out of your own volition gets on, is you do it with all your heart. It's better you adapt it. But still, I have come to appreciate in this world is what is enforced by law enforcement agents. People tend to, if the MOT people are around the traffic lights, people will queue. Once they are out, people will not obey.
Movements.
So, but the truth is still, my own worry about some of those enforced check is that it will lead to some overdiagnosis. It will lead to some people may false positives. So, take for instance, I would have said constant check enforcing that people should do EEG, ECG. As if you are to do some sporting activity, then you should do your ECG before you are allowed to do that. Then if you are getting into somewhere, some profession, you're supposed to do that before you get on. This will now determine people who have these risk factors that you can now try to say, no, don't, and you monitor them. Again, do you know that more male tend to slump and die than female in a ratio of 2:1? And age has a factor to play. As you grow older, the incidence increases. Now, people less than 35 years is scarcely happened within them. Then the incidence is about 0.01 per 1,000 head population per year. Then, if the person now approaches 60 years, it becomes 2 person dies out of 1,000 per year. Then for elderly, you now have 200 dying out of 1,000 per head in a year. You now see that this work on. As people get older, they tend to be asked for this check to increase. So it will help in reducing the incidence. You see, so if you now, because we're talking about activity, remember again, if you don't do exercise, you are in trouble. You are calling the slump and die thing. You will now have all the risk factors we are talking about. The lipid will accumulate, your tightness will come, and then you're more likely going to have slump and die. Because sedentary lifestyle is a risk factor. And then it enhances and fuels slump and die syndrome. So you will now develop exercise. And when you're exercising, some of those cholesterol that are in your lumen that narrows your blood from flowing freely in the vessels, they will be eaten up during those exercise, and your lumen, the vessels lumen will be freer. So it is this internally, and I always say, if some of us that do birthdays, they can inculcate changing their birthday cakes to birthday check. That money that you're using for doing your birthday cake, use it and then do a check for yourself.
And your friends.
Yes. And that will help you a great lot. Because if you watch, even the BVN is tied to your birthday. Even your, license is tied to your, so they actually want to increase that conscience. Once you are doing that birthday, you remember that your international passport is going to expire. This is going to expire. So if we now develop that your own body is allergic or likely to slump and die, then you need to go and check. In our car system, we will now say every 3 months, if you drive a car for 3 months, you will take it to do servicing, and then you change the oil. Why wouldn't you do, at least really, for some people who don't have it? Remember I said that this slump and die runs in family. If your father, if your mother, or any relative had this case of slump and die, you have the internal duty to have this check on you to dictate if you really have it, because a child had a 50% chance of inheriting it from the parents. So if some people in your family are slumping and die, you should try and do everything to make sure that those risk factors are not there. The ones that you bestowed on yourself and the ones that are bestowed on you by nature. But remember again, when we talk about smoking is not just the one that you smoke. Staying where there's smoke, you are equally liable to die young.
Joshua. I came from a deep place.
Like, just to even be around them is a big issue.
Remember, the guy just like pick it on, take it out, all others shares in inhaling. And so, if you are asking you, have you smoked? Don't say you haven't, because if you swear, you will die. Because you have smoked.
Wow.
Once you inhale it, and that's what we call second-hand smoking. And so, this can deposit some things that can be injurious to your health, that can, over time, predispose you to having slump and die.
Okay, so doctor, I know you've explained, first of all, having to, but I want to talk about prevention. How can I prevent this? Because it's scary. I won't lie to you. It's scary. So how can I put myself in a safe position and prevent these things?
Okay. Just like we'll try to say, is internal check. You should do check. They say early diagnosis and prompt treatments can definitely solve the problem. Then you try to, if you're having chronic diseases like hypertension, diabetes, kidney disease, you should try to be religiously faithful to your treatments. If you are religiously following up with your treatments, orthodox treatments, not these ones they give you, you are less likely to have slump and die. Then avoid what's it called? The sedentary lifestyle, from chair to car, from car to house. You know? So you will now try to make out time, walk, do some mild exercise. You know, people, children now, they are not doing something that's these old things that people, it to swell.
Ah, we spoke about it a while ago.
Then doing skipping.
Yeah, skipping.
Yeah.
Swell.
Yeah, swell. You know, these are a form of little exercise that you can do. So you should inculcate that. Then another thing is just like reduce intake of salts.
Salt is that powerful?
It is, and those salts is not the ones, just the ones on table. Your Maggi, your condiments, they have lots of hidden salts in it. So, in fact, a research work has said and confirmed that people who eat out in restaurants are likely to have hypertension more than people who eat homemade food.
So please say that again. Yes, say it again. I have some people that need to hear it that did not hear it. No, I just have a lot of people that need to hear it. So say it again. Please just say it again.
The research has already been proven.
Please, where was this research carried out? Nigeria?
Google it.
Nigeria? I mean, the setting. Was it
No,
in Nigeria or in the West?
Nigeria has collaborated it. The Western, the Americans, it's all over. Just Google it. And you'll see that people who eat in restaurants and processed food are more likely to have hypertension more than people who eat homemade foods. And then if you are doing that homemade food, you should reduce your hand in the condiments that you put, because some of these pre-made condiments had some hidden sauce in it. So you can go the natural thing, the our ogris, the curly leaves instead of the packet one. You know, you can still get what you want.
Organically.
Exactly.
I think it's high time for me to start cooking again. I'm going back to the kitchen.
All right, Doctor, why don't you go? Very quickly, I have this question. So, you mentioned something about adherence. If you have an underlying ailment that's been diagnosed, you have to be judicious. You have to be adherent to your treatment. And now we're talking about people who are seemingly healthy, you know, going for checks and things like that. And I'll go back to the car analogy. All right, people will tell you that they are suspecting something. The car has not actually broken down, but they are hearing a few noises that were not there. But when they take it to the mechanic just doesn't seem to be able to diagnose what's wrong with the car until the car eventually breaks down and it's obvious. And then they'll say, okay, is this? You think that is the same thing with the health sector, where someone says to the doctor, I have this ringing, I'm feeling somehow, my heart is really jiggy. Is there the fear that they will not be properly diagnosed? There's a probability of being misdiagnosed at that point, and they'll rather wait until it is apparent before they go. What is your thought on this?
No, you're absolutely correct, because that's human thing. Is you. If in Nigeria, a lot of cars are grounded because so many bad mechanics would have killed your car of misdiagnosis and then they will not, if after losing some nuts, they will not tight and give you some leftovers. I said, these white people that put those was, are they mad? Say that one is not at
You
all.
don't need them.
So you're right. The thing is also seek for second opinion. Ask some other, even the third one. In council of 2 or 3, you hardly go wrong. So once you see things and you're not, it's still like that. If you take your listen to a mechanic workshop and you see that it's not giving you what you want, look for another person and then consult. Even if when they give you, try second opinion is allowed. I mean, it's just being entirely conscious, but get it and get it right.
All right.
And then you don't wait. Don't feel if you see something that is, don't worry, go, nothing wrong with you. Ask another person, please. And then try and be sure of who you are asking. That they say, you know. So every other person are wearing white coats. People are going to the market with their white coats. No problem. There are doctors, there are a lot of doctors, but they are still fake among the doctors. So people, there's this thing they said, there's no amount of time or duration a lizard that will be in the bush. It will make it to be an alligator. So a lot of people would have been working in the hospital, but you don't know what they are doing in the hospital. And then they will not come to the home and they become doctor because they are working. So if you consult such person, sorry, you always get that lashback. But there's a process and procedures. There are some people who are not even in the process of diagnosis. And then you lay everything on them. You know, and there are some processes things that are happening that people will call you on phone and tell you, I'm having these symptoms. What will I do? I will tell you, I won't tell you anything. Because I'm not there. I will see you. On a more serious note, unless I have seen you before. Yeah. But some people will now, if I now prescribe on the phone, the person will now say, hey, I saw a doctor. He didn't see a doctor, he had a doctor. And so, and then you answer that you didn't see a doctor. And then you will religiously follow that. The doctor has said that. No, I said, no, I won't. I must be sure of what I'm doing. So this can worsen the issue. So the person will now go, and then at the person's unguarded moment, it will strike. So if you have the same thing in spirit of prevention, your father, your mother had this, move forward. If your father or your mother die of hypertension or of diabetes, start on time to check yourself to see if it is, because this one runs in family. So if it's sudden death, it runs in family. Check your heart, the status of your heart, the lungs, and then try as much as possible again. This washing of hand is equally wonderful. I just like say that infective myocarditis and endocarditis, which are the infections of the heart, will always equally lead to slump and die. They have a high percentage of the causes of slump and die that they can. So if you wash your hand properly and then do the personal hygiene up it and your environmental hygiene up it, then you are home and dry. Again, if you now look at where we're coming from, just what you were saying, now this rural-urban migration, there are a lot of urban slump around. There's no ventilation, there's no, and some of the buildings that are in those shanty areas, I wouldn't want to mention. But if you go there, they don't have toilets. And this can. Remember again, if you have a conditions that are other than lungs and heart, like epilepsy, epilepsy can knock you down and then cause you to have slump and die. So if you are taking your drugs for epilepsy, you should keep fit to it. And then only stop it when a doctor said that. Okay? Because it can be a cause. Then meningitis, brain abscess, somebody who have toothache, abscess can form in your brain and that can cause slump and die. Because that's hole in your jaw is a direct opening to the brain.
Saying that any medical issue can potentially cause slump and die? Because you've mentioned a whole lot from the head down to the feet. You're saying that any ailment that obeys infection can can potentially cause slump and down.
Yeah.
Let's talk palpitations.
Palpitation
Is it normal for someone to feel his or her heartbeat?
No.
And when someone feels his or her heartbeat without any provocation, physical, emotional provocation, what should the person do?
Consult your doctor.
Okay.
That's strict. Because if you're doing things that you don't understand, you don't need to hear your heartbeat. It's not normal. But once you start doing that, there is something underlying cause that must have predisposed you to having it. Then allow them to do that. Those that are trained to go the whole to tell you, okay, don't worry. Okay, maybe these drugs, maybe taking coffee can just like get you down there. Then by the person, that's why it's properly to have a correct, full-fledged medical examination. That person do history, asks you, what did you eat? How does it come? When did you normally get it? Do you have this? By the time he has...
It's just the economic implications.
There are a lot of factors.
That's the economic
it's
implications.
time.
Yes, but...
But I still tell you, you will still pay dearly.
But is there like a battery of tests that are affordable, even if you're not able to do
Or
an
the
MRI?
yes.
At least you can do. You mentioned ECG. What's ECG, by the way?
ECG, electrocardiogram.
For the heart.
Yes.
Yeah. So is there a battery of tests that you can say, okay, this is the super pack,
Yeah.
and this is the economy pack.
This is the indomitable.
I said, go behind me, Satan. You can't lure me to this. See, it doesn't really make sense. So, say me, oh Lord, what are
But you know, they can tell you, okay, because we're suspecting you're having probably heart issues, you can go for an
Yes,
MRI.
go
And
and
we know MRI, you go drop 100K or something.
don't worry.
But rather go for ECG. ECG is like,
don't worry.
Yes, this is like 20K.
Medicine is
Help
not,
us.
it's not all about that. What I would try to tell you is just like, for the economy, okay, see any public hospitals, if especially the tertiary hospital. If you're around here, go to places like UNTH or any teaching hospital, right? So there, people, you will not see, there's not a personal thing. Somebody is not sending you because of what you may feel that he's getting, if that's your problem.
there's something that came to mind before I forget. Can someone actually walk into a hospital and say, I want to have this test or that test without being referred from a doctor? For example, someone listening on this interview can say, okay, I felt palpitation the other day. Let me just go and get an ECG.
Yes.
The person can access that service without any
Having to be
referral from
referred,
a doctor.
yes. Or written paper from a doctor.
They will always ask you. They will always ask you to see a doctor.
But do patients have the right to say, I want to do this test based on information they have?
No, the level of healthcare, that's what we call patient centers or client center care. You are not at wrong.
Okay.
It's you.
Okay.
So, but what I'm trying to say you, what it means that having conversation with your doctor, you will say, okay, wow, you are having this, rather do this one than doing this. Then you now have an informed decision to make.
The doctor helps you narrow it down.
Exactly. Tell you, in addition to this, if you're having this, it may not just be this that is causing that. The palpitation
So
may be...
it's safe to see your doctor.
Exactly. In as much as you want that, no, get that counsel from him, and then no. Some are not relevant. Something you want to, there are things that you can dispense with just history. You may not get to MRI. Okay? You can just dispense it with that. And then we always cut our own clothes according to cloth, our own coats according to clothes. We don't cut it according to size. In medical world, the ideal medical person will not kill you or breed you to death because he wants to help you out. No. So you always know the patient's status and know how to push it out, and the person will not get the thing that he wants.
Doctor, so before we let you go, because of time, this has been really enlightening. I won't even lie.
Scaringly enlightening.
Yes, scarily, add that word in cap locks. So before we let you go, in your own medical opinion, what are the key steps Nigeria should take, both on an individual and public health level, to mitigate the risk of sudden death?
I'll start from the globally, as in from the corporate world, governments. I strongly beg and I'm pleading that our critical care services should be looked into. The ambulance services, how people are treated. You know, I believe that if the government will look in that, when I just mentioned the ambulance services, you just were like, am I in Nigeria? Am I in the world?
Yeah.
So we should draw that down to be. Let ambulance services be readily available. You know, so people can call once they notice that, and then it will help save a whole lot of situation that people can't get to. Now, then on individual basis, we've already talked a lot about, you know, you checking for yourself, do that internal check. If possible, adapt this, changing your birthday cakes to birthday checks. Then try and encourage. But what still, if you have had a family history of this disease, you should try as much as possible to even double check. Then, environmentally, people should always know what they eat and where they come from. In terms of content, because excess ingestion of salts and some other and fats is not good for all of us, because it's a narrow way to slump and die. So they will narrow this, your breathing, and if you are having conditions like asthma, anytime you are going out, don't miss putting a spare inhaler. Because it can. And then try to avoid some things that you are allergic to.
All right, Dr. Nwachukwu, we are out of time. I wish I had you longer, because I wanted to take you up on that ambulance services. But what was just ringing on in my head was, you know how schools these days have taken over transportation. They provide buses to convey their students. I'm wondering what's holding hospitals to provide ambulance services, not just for corpses, but you know, for emergency response.
It's not for corpses.
It's not for corpses.
Yes, you're right. Yeah, thank you so much. But then you find out that what we call ambulance here
is to come and carry.
So when I mention hearses, people, nobody will understand what I mean. But when you mention ambulance, you're saying somebody has died. All right, so our aim here is to communicate, which is what we try to do. Thank you so much, Dr. Nwachukwu.
So much.
Always a pleasure to have you here. I wish I had you here longer. You're lucky.
I think you are. You say you want to take me up, I'll fly with you. Don't worry.
Thank you
the pleasure
so
is
much.
mine for the opportunity. And I pray that with this, a lot more would have been dragged out of the jaws of slump and dying syndrome. Please, internal check is the thing.
Thank you so
Thank you very much.
All right, that's the much we can have for this segment. And please, do go check on yourself. I know the economy is biting hard, but it's best to be safe than to be sorry. Don't go anywhere, and don't forget, this is the Signature TV New Day. Head on over to our social media platforms at Signature TV Official. Like, share, comment. Don't go anywhere. We'll be right back with more interesting topics.
Thank you very much.
Yes, the role of nurses has actually evolved. Nursing has gone beyond having the nurse at the bedside to treat the patient, to having the nurse being in charge of a community. Like we train our nurses in community health, making them to realize that we are part of the community. The community to feel us. And the community need to know what is around them, and they also need to know how to engage in in a healthy living through health education. When we give them health education, we allow them to process it and have change behavior. And that change in behavior is evident that that health education has actually gotten them. And when they do that, you see them taking charge of their health, taking informed decisions, doing things that will involve, that make them remain healthy. And also, in the school, we have school health program. Before now, the school health program is not even noticed. We have the school health program where the nurse takes care of the school child, both ensuring that the learning condition is conducive, ensuring that that child is well prepared for academics, ensuring that that child has good nutrition that will make that child be healthy to receive learning. And also, we also go about engaging them in extracurricular activities, games, physical and health education, having them to do that. In those days, in my own time, we do swear. But now we have them go play chess, do other things that will make the school child healthy.